Hello, I'm Dr. Jeff Orr. I'm one of the orthopedic doctors with Tahoe Orthopedics and Sports Medicine.
And I'm Dr. Kyle Swanson for Tahoe Orthopedics and Sports Medicine, and this is your Barden Health Peek.
Today we'll be talking about joint pain and joint replacement with the Mako robot.
It can be injuries, it can be just normal wear and tear over time, and then it can be arthritis.
It can be very mild where it's more of an inconvenience and bothers people versus fairly debilitating where it can affect your quality of life, affect your work, and especially affect your sleep as well.
We live in an area that most people are very active, and so when you have these symptoms, it can be debilitating and limit what you can do. The goal is obviously to keep people as active as possible so they can enjoy those type of activities.
So over time and with use, joints can develop more wear and tear, which can lead into arthritis, which can cause increased pain and decreased function in the joint. This can be very mild and can also become fairly debilitating.
Initially, if it's just mild pain, it can be something just as far as like modifying your activities, avoiding the high impact activities and doing something that's less impact, such as cycling or swimming.
You can also try physical therapy that works on strengthening range of motion, improving function of a joint. You also can step it up and try an injection into a joint, and that can be a steroid injection, something called hyaluronic acid, which is the naturally occurring substance in your knee that can help decrease some of the inflammation as well. There's also a platelet-rich plasma or a PRP injection, and stem cell injections are also in that realm of possibilities for injections.
And then lastly, surgery, depending on what type of injury and what kind of pain. But certainly with severe arthritis, it can be total joint replacement is the main treatment. So Makoplasty is the latest technology that's out there for total joint surgery, and it allows us to get a three-dimensional reconstruction of the knee using the CT scan, and that allows us to prepare for the surgery prior to even doing the surgery. Not everybody's knee is the same, and so with this technology, we're able to predict what the anatomy is and then able to perform the surgery based on that patient's anatomy.
The benefits to a patient include a more accurate pre-surgical plan, which allows us to make a smaller incision, less retraction, less joint manipulation during the surgery, and all of this translates into our patients moving more quickly with less pain after their surgery. Patients are walking within 4 hours of their replacements.
So for patients that are dealing with joint pain, certainly the first thing to do is get a referral to see an orthopedic specialist. And treatment, again, may depend on what stage that patient's at with regards to their pain. And certainly it can be starting off with just very conservative, like physical therapy and activity modifications and medications, all the way up to joint replacement surgery, just depending on where that patient is.
At Barden Health, our goal is to keep you moving and to keep you active. We have a ton of great resources at bardenorthopedicsandwellness.com. Please visit our website for more information.